Hello. If you're thinking of having teeth implants or some form of dental implant, I'm going to tell you something that your dentist or your dental surgeon has not told you. And I've just had dental implant surgery. So I'm going to share with you my experience. So please listen to it and you have a look whether I'm telling the truth or not. Now, first of all, the background. My name's Joe Johnson. I've been helping people, treating people with natural remedies for over 20 years. Now, many years ago, I had an accident and I lost my front teeth. So my dentist at the time did a bridge where they put the false teeth in and fixed it to the roots of the teeth that were still there. And it was there. That was 20 odd years ago. But recently, I had another minor accident and it meant that the bridge came loose and I went to see the dentist and he said, Mr. Johnson, you know, you're going to have to lose your front teeth and wear a denture. And I said, I don't really want to wear a denture. Are there any alternatives? He said, yes, I can recommend a friend of mine. He's one of the best dental surgeons in Britain and he can do you some dental implants. I said, fine. I went along to see this eminent dental surgeon and he had a look and he said, right, this is what I propose. And he proposed taking the roots out, the remaining roots, doing a bone graft, which is taking some bone and putting it into the jaw all the way across up there, because my jawline had receded over the years. So I put a bone graft in, then also put 2 dental implants in. Then all this is done is put a cut across the gums, a wide cut about that wide, and then he was going to sew it all back up and then let it heal. 3 months later, he proposed putting the dental implants in position, and that would be it. I said, fine, fantastic. So we made the appointment to go and see him on the Friday. So I went along and said, before you come, he gave me a prescription. He said, take 3 grams of this powerful antibiotic 1 hour before you arrive. And I said, well, you know, I'm into natural remedies. Do I have to take this antibiotic? And he said, believe me, if you get infected, you can die from infection. And I didn't want to die, so I did what the expert said, and I took the 3 grams of antibiotic before the appointment. So I went along, and he anaesthetized me. I didn't want sedation. He said, you know, I was given the option. I didn't want the sedation, but I had the anaesthetic. And then while the anaesthetic was taking place, he said, you know, what are you doing? And I said, well, I'm going away a short holiday next week. And he said, next week? I said, yeah. And he just looked at me a bit strange, but anyway. So he then got on with the operation and I just sat there for 2.5 hours while he did whatever he did. I ended up with about 20 stitches up there above the gum line. He's put a bone graft in there and he's put 2 dental implants in. Now I'm going to show you because I've still got dentures. We've got a dental implant in there, up there, and a dental implant in up there. Now, after he's had this operation, he sent me home. And I must admit, I'm quite a tough guy, but I was quite traumatized by the severity of the operation. I felt quite tired and shocked. But I got home. Now, to say my mouth was sore is a vast understatement. I was in agony. I couldn't eat. I could just about drink a cup of tea as long as it wasn't too hot. My mouth was so sensitive. My whole gums were so sensitive. These dentures I've got in, I couldn't wear them because the dentures were pressing up against the swollen gums. It was just too sore. So I couldn't go out without any teeth in. But I was in that much pain anyway. I was in bed for almost a week. Now, at the same time, when I left the dentist, he gave me a prescription. So apart from the 3 grams of antibiotics, which I'd already had, 500 milligrams of amoxicillin, 7 for 7 days, and 400 milligrams of metronidazole for 7 days. So that's 3 lots of antibiotics, and my gums were still killing me. I couldn't eat. I was virtually starving. I was pouring soup down the back of my teeth, trying to bypass my gums. I was unable to wear these dentures. And even if I did have to see people, you know, they give you this glue stuff. I couldn't glue the dentures in because you can't glue dentures onto liver. Like it was like liver. My gums were so swollen and sore and red. It was like raw liver. So I was stuck in the house in agony for a week. They never told me about this. I got on the phone to them and then they said, oh, I'll take some mouthwash, some of this really expensive mouthwash. Now, it might be good for whatever it's good for. It's certainly no good if you've got getting dental implants. That doesn't do you any good. And I said, what's wrong with me? He goes, oh, well, I went back to see another friend of mine, the original dentist, and he said, oh, you've got implantitis. I said, what's implantitis? Now, this was the first time I'd heard of this word. He said, oh, it's really common. All it is that your gums are inflamed. It'll go away in time. I said, what do you mean, all it is? I'm in agony. So he said, no worries. Take some of this, extra strength ibuprofen. Did not touch it. I said, that doesn't work. So he said, take some of that tramadol. I was high as a kite. That was no good. So I couldn't work. I couldn't eat. I couldn't sleep. I was lying in bed I was going off my head. I tried buying some of this stuff just to reduce the pain, these things. I tried buying some of this gel. That did nothing. Nothing worked. Now, by now, it was a week later, so I'd been taking antibiotics for 7 days. I'd been off work for 7 days. The gums had just started to heal a bit, but I could literally suck and the blood would come into my mouth and this nasty pus would come out of the gum, seep out. So I said to my friend, look, I've got to go to work and I can't wear these dentures. It's so sore, I can't wear them. He said, no problem. And he made me this gadget. It's like a gum shield, but with teeth in the bit there. I mean, from a distance, it's quite impressive. From a distance, it just looks like teeth. And you've got the benefit here. There's no plate pressing on the gums. But it's still not good. I mean, gums were still very, very sore. But he tried, at least he tried. Anyway, I said earlier, my occupation, I've been helping people with natural remedies for 20 years. Now, 22 years ago, I came up with this remedy, Gum Doctor. It's for receding gums, bleeding gums, spongy gums, people who gingivitis, that kind of thing. And it's so simple and easy to use. It kills off any infection and it promotes rapid healing. Now, I had nothing to lose and I literally went like this. This is how easy it is to use. Now you see that brown liquid? The first time I used this remedy, I could hardly touch my gums. I put it on. Now, bearing in mind, I've not used this for 15 years because my gums have been all right. I occasionally put it on if I feel my gums bleeding or whatever. Gum infection, it's very good for gum infection. But I put it on. And about 2 minutes later, I thought, I don't believe this. I could literally feel my gums getting better. So I took this stuff out of my mouth. I put more Gum Doctor on. I just put it on for a few hours, once an hour. I put it on at night, and when I got up in the morning, I knew I was getting better. I could wear dentures. I could have a breakfast for a start. I could eat what I wanted. And within a few days, the gum infection had completely gone. Look, I can eat crisps, chips, what I want. There's still the implant up there, and there's the implant up there, and I've got to wait another 2 months now for the bones to heal inside. The important thing is my gums are rock hard now, they've healed. Now, if you're thinking of having dental implants, I'm telling you, get Gum Doctor before you have the implants. Discuss it with your dental surgeon, discuss it with your dentist. Don't just do it off your own back. But I'm telling you, if you try, you'll be amazed at how much pain you will be in with your gums, how sore they are, because I certainly was. And this will stop the soreness, stop the pain, get rid of the infection, and your gums will feel fantastic. You don't want to have a week off work in bed. You don't want to be hiding from your loved ones and your partner because you're too embarrassed to walk around without your teeth in. Because if you get inflamed gums like I did, you can't put your dentures in. That's where Gum Doctor will help you. No more embarrassment, no more pain, no more infection, no mouthful of pus. You'll have solid, rock solid, healthy gums. And it's just a little bottle, put it in your pocket, carry on, go to work, do whatever you want to do. It's so easy to use. And that's my real story. Now I've got another 2 months to wait, and then they're going to put this implant in, this dental implant. Well, the implants are in, they're going to put a bridge in, bolt the bridge in, straight into the jaw. And hopefully that'll last for the rest of my life. And I wish you every success with your dental implants, but look after your gums and use Gum Doctor. I'm so convinced it will work, and I really mean this. I'm so convinced it works. I'll give you your money back if it doesn't work. 100% of your money back, guaranteed. It does work, and you will wish. If you don't get it, you will kick yourself if you get a gum infection like I did. You will kick yourself. Because there's nothing worse than not being able to eat, not being able to drink, not being able to sleep, not being able to even smile at people because you've no teeth in. Because you won't be able to stick your dentures on your gums once they're swollen and bleeding and soggy like liver. Put this stuff on, and it's like a bloody miracle. It really is. I devised this 22 years ago, and I had no idea how good it was. So there you are. Anyway, good luck with your dental implants. Order the Gum Doctor, I'll get it sent off to you. And if you have any questions, get in touch. All right, bye for now.